But I want to turn to another condition that's really been grabbing more than its share of press here recently, and that is arthritis. And we know that some of the well-known treatments, such as Vioxx, Celebrex, have caused such severe side effects that you can't even pick up your newspaper, turn on the radio or your TV without hearing about it. And with all that negative press, people are turning to other methods to give them some help, to give them some hope. What hope, what help can they possibly get from noni juice for this problem?
1,675 people throughout the world took Tahitian Noni juice just to see if it would help them with their arthritis. 78% said it helped them. And they took on an average of 3 ounces a day. Now, how did it help their arthritis problem? It helped with the chronic pain. It decreased the chronic pain. It helped with energy. It gave them more energy and just made them feel better.
About a year ago, I found I was in such pain, and what happened is I was getting these shooting, this sensation up and down my arms. I had numbness and tingling, and I went to the doctor, and he gave me, told me take all these different supplements because I couldn't take any of the drugs that were on the market. And so I went for physical therapy, I went for massages, and I spent thousands of dollars, and nothing was working. Well, my sister told me about Tahitian Noni juice. She had seen another woman at work have health improvements. She tried it for herself. She had some health improvements. And so when I ordered it, I started taking some right away. As soon as I got my bottles of juice, I opened one up and I drank an ounce. And I noticed a change within an hour that I didn't have that shooting pain. Today I have all my mobility back. I have all my movement back in my hands, and I can open up the bottle of noni juice even without any device. I also can do everything I used to do. In fact, I have not felt better. I can't even remember the last time I felt as good as I feel now. I drink 3 to 4 ounces a day. I don't ever stop, and I will never stop drinking Tahitian Noni juice because my husband, he got back his wife, my daughter, got back her mother, and I got back my life. So I'm sold on Tahitian Noni juice. I'll never stop using it.
So you're starting to see how this works. Noni just affects many different symptoms for many different conditions that can make you feel better. I believe that Tahitian Noni juice can help most people with arthritis symptoms.
Going back to drug side effects for treating arthritis, there's been a lot of news about the increased risks of heart disease in drugs containing COX-2 inhibitors. Now, people who drink noni juice, do they have to be worried about having some of these same side effects?
In my study of over 25,000 Tahitian Noni drinkers, there was absolutely no evidence of any increased evidence of heart disease. Vioxx, Celebrex, naproxen, Aleve, it ranged from an increase of 50% to 250%. And I think the reason is there are different mechanisms of the way it's cleared from the body. The synthetic drugs are detoxified and cleared from the body through what's called the CYP450 system, whereas noni doesn't use that system. Tahitian Noni juice is cleared through the hepatic system. According to the PDR, there's data that shows there are no observed adverse effects from Tahitian Noni juice.
Our viewers may be surprised to learn that diabetes trails only heart disease and cancer as a leading cause of mortality in the United States. Now, while it's true that there is no known cure for diabetes, Dr. Solomon, your findings suggest that as many as 4 out of 5 diabetes sufferers can find some relief by incorporating a steady regimen of noni juice.
That's right. we looked at 5,575 people who had diabetes and who drank Tahitian Noni juice. Of those, 82% said, there's no question about it, it helped me in some way. The average that they drank was 3 ounces a day.
My son Joshua was diagnosed with diabetes at the age of 3. And one of the things that they do when you have diabetes is send you in for regular checkups. Every 3 months we go in for a clinic. And this is just to assess for complications and make sure things are running smoothly. One of the tests they do at those clinics is called the glycohemoglobin A1C test. And this tests your blood over the past 3 months to see what your average blood sugar reading has been. The goal is to be under 8%. And when we got Josh's reading back that month, it was over 14%, which puts him in a high-risk category. And the entire management team came in and sat down with us, and we talked about what we could do different, and which was hard because he was so young that trying to keep everything going was really a struggle for us. And shortly after we left, and as we were deciding what we were going to do at home to make things work a little better, I was introduced to Tahitian Noni juice. And as we talked about it, we just thought it's worth anything right now is worth trying if it's going to help. So we started giving Josh 2 ounces every day, and he thought that was a real treat because he wasn't used to having juice. And so he was so happy to take his 2 ounces, and he actually drank it right out of the bottle, just enjoyed having his own bottle and his own thing that he got to do. So for 3 months, he regularly took his juice every day. And when we went back in for our clinic and got our A1C reading, it was at 7.4%, and everyone was amazed. The entire team came back in and said, we've never seen a glycohemoglobin cut in half in a 3-month period, and what have you done different? And as my husband and I sat there and thought, the only thing we could think of that we had done differently was to be using the juice. And they were amazed. They were amazed by the juice. We actually left a bottle there with them because they were so amazed at what it had done. And we really enjoy the juice. Josh still takes it. He's 12 now, so he's taken it for this many years. And we've noticed a lot of benefits from it, not just his lower blood sugar readings, but also an increase in health. It's strengthened his immune system and done a lot of great things for him, both as a diabetic and just as a healthy child. I would recommend it to people with children with diabetes, but also just kids in general. All my kids take it now, and we feel like it's been good for all of our children, health-wise.
More than 17 million Americans suffer from asthma, a number that has more than doubled since 1980. And most people realize that with severe asthma, tasks like walking up a flight of stairs, taking a leisurely stroll outdoors may result in several hours of labored breathing. What you may not realize is in some of these cases, especially among the elderly, asthma can be fatal, although most asthma deaths are preventable. Amazing, Dr. Solomon. Your findings indicate that Noni may benefit more than 70% of asthma sufferers. Tell us about Noni juice and asthma.
What you say is absolutely true. And it's going to get worse because there's more pollution of our air, our water, and our food. All 3 of those are triggers of asthma. And they're all getting worse, not better in this country. So we can expect more asthma. But of the 8,077 people who had asthma and who took Tahitian Noni juice, 71% said it helped their symptoms. They either breathed better, they didn't have the compression of their chest, they didn't cough as much, they didn't wheeze, and that was on 2.5 ounces.
Up to this point, our discussion has covered a number of physical ailments and conditions. Now, I'd like to ask you about emotional or psychological ailment. I'm talking about one of the true plagues of modern life, clinical depression.
It is a true plague. It's terrible. And people who are depressed don't even know it at the beginning. many times, but others around them will know it because they slow down, they're not with it, they don't eat as well, they're irritable. It can just be a terrible thing. It's a terrible thing on the person who has it. It's a terrible thing on the family. Now, there are three types of major depressions. One is the type we all know about. You just get depressed and you can't do much of anything, and you just want to vegetate and you want to be left alone. Don't bother me. The next type is what they call dysthymia. That's a milder form. You have a lower mood and it lasts much, much longer. Then the third type is bipolar. Bipolar, you go down like the major depression, but then you bounce up like you're hypomanic or manic. And then you go down, and then you go up. And when you're up, you can do all kinds of crazy things. You can go out and buy all kinds of things on credit cards. You can get into fights. It's just a tough situation because you don't have the judgment at that point, and you don't realize what you're doing. And then you go down, you just want to get away from everything. In fact, sometimes you want to commit suicide. So these are life-threatening disease. The thing that's truly amazing about this is that out of 1,512 people who had a mixture of these depressions, 80% said they were helped. And not only did they say it, their family members and friends said it too. Said yes, they were helped. And that was about 3 ounces a day. There's now new research to show that this is not a psychological problem. It is a chemical imbalance in your brain. It's a chemical imbalance between the faulty production and utilization of serotonin, dopamine, GABA, and neurotransmitters. So there's a real reason for it. Again, what does Tahitian Noni juice? It helps bring people up who are down, and it helps people bring down who are up.
Yes. You know, Dr. Solomon, I think the statistics are staggering about people who either have depression or who have been affected by it, either directly in the family or just running into people on the street. I think that's some good news for a lot of people once they get to know all of this.
Thank God.
Dr. Solomon, in your book, you have a section that deals with multiple sclerosis and Parkinson's disease. Your research in these areas didn't have nearly the same number of contacts as in other conditions, yet you mentioned that Noni appeared to relieve symptoms in more than half of the respondents. What leads you to believe that Noni juice may also benefit those who suffer from these conditions?
The reason that I put it in was if you have MS or if you have Parkinson's disease, you're looking for help. Mm-hmm. And I didn't have enough to make it statistically valid in any way. This is, I'm not saying it helps, I'm not saying it doesn't help, I'm saying I don't know. Mm-hmm. But it just happened that out of 25 people who had MS, 52% were helped on 3.5 ounces a day. When it comes to Parkinson's disease, we again had 25 people, 52% were helped on 3.5 ounces a day. And there, the brain cells that make dopamine die faster. Now, I'm not holding out this as any panacea at all. I don't want to give anybody any false hope. On the other hand, I didn't want to not mention it because some people, a few did appear to be helped. So what I'm interested in doing is getting more and more data to see, does it really help? Will these statistics hold up when the numbers get greater?